Tele-PrEP, an intra-provincial pilot to offer HIV preventative solutions in rural and remote areas across health authority boundaries. We'd like to welcome you to our Tele-PrEP pilot project presentation. I am Deanna McDonald, Clinical Care Coordinator for the Health Outreach Team for Interior Health in BC. And co-presenting with me is my colleague, Lindsay Barton, Clinical Nurse Educator in Clinical Prevention Services, STI and HIV for BC Centre for Disease Control, who will present the process portion of the slides. We'll be looking at Truvada pre-exposure prophylaxis or PrEP use in the Interior Health region of BC and discussing a pilot project process aimed at addressing some of the barriers to access experienced by people living in this corner of the province, especially in some of the more rural and remote areas. We began the overall process in the fall of 2020 and officially launched just recently in February 2021, so very early in the actual pilot, thus this presentation speaks more to the planning and process stages. Evaluation is planned in the coming months once we have confirmed an effective process is in place with enough participants to provide meaningful data. I'd like to start with providing some context and discuss the health regions in British Columbia, which consists of 5 separate health authorities: Northern Health, Interior Health, Vancouver Coastal Health, Fraser Health, and Vancouver Island Health. As you can see on the map cutout, Northern Health in green has the largest geographical area, though the lowest population, and Interior Health is second. In addition to the 5 regional health authorities, BC has 1 provincial health authority, PHSA, which includes the BC Centre for Disease Control. The BC Centre for Disease Control provides provincial and national leadership in public health through surveillance, detection, prevention, and consultation. BCCDC's structure combines service delivery, policy advice, and research with a mandate to work closely with partner health authorities, health professionals, and other stakeholders to continually improve patient safety and quality of services. To better understand how geography and population impact health services, we need to consider population density. To illustrate, Vancouver Island Health Authority, or VIHA, is the health authority that's the closest comparable to Interior Health in terms of population size, with a difference of approximately 50,000 more people in VIHA. Population density represents the number of people living within 1 square kilometer. Lower densities indicate more rural areas, which typically have less access to health services, while those living in urbanized areas with higher population densities typically have greater access to health services. Looking at the map cut out again, VIHA is the small blue-green island just off the west coast of BC. Interior Health has a population density of 4 people per square kilometer versus 24 in Vancouver Island Health. So it's assumed that Vancouver Island has easier access to health services over Interior Health, and we believe this impacts access to things like PrEP. Despite similar population size, Vancouver Island consistently dispenses 40 to 50% more PrEP and has 20% more providers. Geography seems to be a key factor when considering access to health services, including PrEP. Now to talk a little bit about who oversees PrEP in BC. PrEP in BC has been free to those who are eligible since January 2018. Enrollment is managed centrally for the whole province out of the BC Centre for Excellence Drug Treatment Program in Vancouver, BC, where the application and prescriptions are sent for approval and then forwarded on to St. Paul's Hospital for dispensing. In Vancouver, medication is picked up at the hospital. Outside of Vancouver, meds are sent to a partnering community pharmacy or other pre-approved location in community for pickup, such as a medical clinic or other pre-approved location. Medications cannot be sent to someone's home. Initially, medication is dispensed for 30 days to assess for tolerability and then ongoing for 90 days. Healthcare provider support continues with ongoing monitoring. BC is seeing a decline in new HIV diagnoses. However, we still have a long ways to go. We have seen a decrease from 198 in 2018 to 142 in 2020, and would like to attribute this and further decline to the addition of PrEP as a tool in preventing HIV. Let's look at eligibility. Initial eligibility assessment often starts with a HERE score, which is simple 7 questions. If it is 10 or greater, clinicians evaluate for intensive HIV prevention services, including PrEP. If the score is below 10, providers discuss standard HIV prevention services. On average, 76% of individuals accessing PrEP have a key qualifying HIV risk factor of greater than 10 HERE score. Overall, eligibility often presents with concurrent risk factors that include a HERE greater than 10, prior rectal STI or syphilis, identify as GB-MSM or trans women, have accessed recurrent post-exposure prophylaxis or PEP use, and or have an HIV partner not on stable antiretroviral therapy with an unsuppressed viral load. Of course, eligibility also extends to heterosexual men and women and people who use injection drugs and have partners not receiving stable antiviral therapy and a viral load greater than 200 copies per mil. In Interior Health, our health outreach nursing team hosts monthly PrEP clinics in various communities that offer private and confidential STI testing for gay, bi, trans, two-spirit, and queer people. Part of the initial assessment includes conducting a HERE score and helps to identify individuals that may be eligible for PrEP. Through discussion with clients during STI PrEP clinics, talking to organizations providing support for people living with HIV, and other providers offering men's sexual health services, it was determined that the current access to PrEP was not equitable in all regions of the province, especially in rural and remote communities. Stigma and lack of providers were identified as the main barriers. Others were lack of sexual health clinics, which don't formally exist in Interior Health, not comfortable accessing care in their home community, lack of awareness, and geographical barriers with lack of transportation, med pickup requirement locations, and lab accessing becoming an issue. Also identified was a combination of lack of comfort on local prescribers' part in prescribing PrEP, with lack of ability to actually get a doctor. As a matter of fact, in one small rural community, it was reported that the waitlist is about 800 people needing a physician. The SexNow 2019 national study surveyed GBT2Q men across Canada, and some key takeaways that informed this initiative included GBT2Q people in rural and remote environments, such as small city or rural areas, were less aware of PrEP and about half as likely to be currently taking PrEP compared to folks in large to medium cities. GBT2Q in rural and remote environments were more likely to report prescriptions, cost, and judgment from healthcare providers as barrier to PrEP access. Cost, of course, is no longer a factor in BC, however, it still remains an issue in other provinces. They were also less confident in their ability to get prescription for PrEP for various reasons, including those mentioned, and actually about 2.5 times more likely to report not being at all confident about their ability to get a prescription. Some information that was provided by the drug treatment program includes only 7.4% of PrEP prescribers practiced in a rural location, according to the postal codes, and only 17% of PrEP participants were outside Vancouver and Greater Vancouver areas combined, which is a very large area of the province geographically. I'm now going to pass the rest of the presentation over to my colleague, Lindsay Barton.
Thanks so much, Deanna, and hi, everyone. Thank you for your interest in our presentation. I would like to take a moment to just acknowledge that I'm recording my part of the presentation from the unceded lands of the Squamish, Musqueam, and Tsleil-Waututh peoples. So our first step when we decided to create this pilot was to speak with those physicians, administrative, and nursing staff who would be directly involved with providing client care within the pilot group. So together we began with brainstorming ideas for the structure of the pilot. First of all, deciding how client visits would be conducted was actually fairly easy. All appointments would be held virtually via Zoom. And thanks to the current pandemic, this was actually a pretty easy decision, as virtual care has very much become the norm in many clinical settings. Next, we discussed how interested individuals would be identified and how eligibility for PrEP would be assessed. We talked about where in interior health would be the best to start. We wanted to keep the pilot small initially since we were unsure about what uptake would actually look like. As such, we decided to launch in a small subset of interior health around the Penticton area. We identified some possible logistical barriers, namely delivery of medication to local partner pharmacies and involvement of local labs for specimen collection and delivery. We discussed how we would get the word out to prospective individuals about accessing PrEP through the pilot. Firstly, of course, the first way would be through direct contact with clients presenting for STI testing during prick test events in their communities. Second, and an essential way to spread the word, of course, would be through communication and involvement of local community partners, such as the Health Initiative for Men, Community-Based Research Center, and Options for Sexual Health. So once we'd worked through various ideas, our next step was to finalize the structure of the pilot and to work through some of the logistical challenges. So as Deanna mentioned, in BC, all PrEP for individuals enrolled in the provincially funded drug treatment program through the BC Centre for Excellence is dispensed through the pharmacy at St. Paul's Hospital in Vancouver. Those who live locally are able to pick up PrEP directly from the pharmacy. And those who don't live in Vancouver, the pharmacy will ship the medication to a local pickup point, typically a community pharmacy or the prescriber's office. Historically, however, this has been linked to when the prescriber is also not local to Vancouver and is in the same location as the client. So for the pilot, we needed to partner with St. Paul's Hospital pharmacists to make sure that there would be no issue sending medication to a client outside of Vancouver when the prescriber is listed inside of Vancouver, as are the physicians at the BCCDC who would be the prescribers for this pilot. The pharmacist at St. Paul's Hospital was actually very keen to be involved and to help facilitate access to PrEP for those in interior health. She helped to identify local partner pharmacies who were willing to act as pickup locations. She provided information and direction to those pharmacies about their responsibilities, which basically include receiving the medication, holding it for pickup, and taking it off the shelf if the client hasn't picked it up within 30 days. When Tele-PrEP clients enroll in the program, the St. Paul's Hospital pharmacist will actually phone the client to provide prescription consultation and education over the phone prior to the client picking up their medication locally. We also identified the local health outreach clinic as a pickup location, as in smaller communities, clients may not actually be comfortable picking up PrEP from a local pharmacy if they perhaps personally know the pharmacist or any of the other pharmacy staff. Another logistical piece that we had to work around was ensuring that clients had access to requisitions for any necessary blood work and other STI testing. So once established on PrEP, routine blood work to monitor kidney function as well as HIV status is recommended every 3 months. Upon consenting to virtual care, clients in the pilot are emailed any requisitions that they need. That includes a standing requisition to have on file at their local lab once they're established on PrEP and having their blood work done every 3 months. This requisition includes not only kidney function and HIV status, it also includes testing for syphilis and urine chlamydia and gonorrhea. However, site-based testing for chlamydia and gonorrhea in the throat and or the rectum is also recommended every 3 months. So, of course, normally clients would complete any required swabs while seeing the clinician during clinic appointments. However, since appointments for pilot clients are exclusively conducted over Zoom, we had to identify how to facilitate chlamydia and gonorrhea testing and ask the local labs in interior health to partner with us on this. One thing to note is that we have both private and hospital labs in BC, and neither of them typically provide the swabs to clients for this type of testing, nor do they process rectal and throat gonorrhea or chlamydia samples. This is typically done at the BCCDC Public Health Lab in Vancouver. So thankfully, the BCCDC STI clinic had already put a process in place for our own clients who elected Zoom visits at the start of the COVID-19 pandemic. We mail out swab kits containing a 1-year supply of throat and rectal swabs, along with all appropriate labels, requisitions, and instructions for collection and drop off at the lab to the client's home address. What we needed to do for the pilot group was to have the local labs familiar with the project so that clients could drop off their completed throat and rectal swabs, which would then be sent to Vancouver for processing. So we connected with the labs in the area so that they could ensure their staff were familiar with the process. So once established on PrEP, clients would arrive to the lab with a requisition for blood work, which was to be drawn and accessioned into the system per usual protocols. The client would also be able to drop off a package of completed swabs. Lab staff would double check labeling, date and time of collection on the requisition, and then send it directly to the BCCDC lab without needing to enter those into their lab system. All tests would be ordered under the prescribing physician at the BCCDC, and all results would also be copied to the local health outreach RN in Interior Health, who would manage any positive chlamydia or gonorrhea results to facilitate easier access to free STI treatment medication locally. So once the pilot was designed and logistics were figured out, we met virtually with individuals from Health Initiative for Men and Community-Based Research Center to review the pilot, familiarize them with the process, and ask them to provide information to any individuals who may be interested in accessing their PrEP through BCCDC. Since we wanted to start small, we didn't want to engage in a widespread communications plan up front. We really wanted to be able to test out the pilot processes and work out any kinks first, as well as to assess the actual interest in accessing PrEP through this route. What we did is that the Health Outreach RN in Penticton also created a handout to provide directly to clients during testing events and to share with our community partners that had a brief description of the pilot and instructions for contacting the BCCDC to book an appointment for those people who were interested. So this slide just gives us an overall picture of the process for the client accessing PrEP this way. I will mention that even though we offer these appointments via Zoom, we've intentionally labeled the pilot Tele-PrEP as we needed a way to distinguish this cohort of clients from our own PrEP clients at the BCCDC who are local to Vancouver, as the processes are slightly different for getting people their requisitions, getting people their swabs, etc. So first off, eligible clients are identified through testing events or communication with community organizations. The client self-refers to the BCCDC by calling and requesting an appointment for Tele-PrEP. Consent documents and a baseline blood work requisition are emailed to the client. They have their initial PrEP visit with the physician via Zoom. Then the physician submits their enrollment form to the BC Centre for Excellence at St. Paul's Hospital. Upon approval, the pharmacist from St. Paul's calls the client, provides medication counseling, and ships the medication to a local pickup pharmacy. The client follows up with the physician at 1 month and then every 3 months once established on PrEP. Clients are provided with an at-home swab kit for site-based chlamydia and gonorrhea testing, which is to be dropped off at the local lab every 3 months when the client presents for routine PrEP blood work. And any positive gonorrhea and chlamydia results are followed up locally by the Health Outreach RN in their community in Interior Health. So we are fairly early in the pilot, but we do have a few observations, lessons learned, and next steps to share. Number one is that there's been really slow uptake, actually. We had a soft launch of the pilot on February 16th, which coincided with a PrEP STI testing night in Penticton, and which was followed by a second test night in mid-March. The local Health Outreach RN reported that she did provide information on the pilot to a few clients who were expressing interest, but we had no actual uptake from any of those clients. So that really caused us to reassess our approach. First, we wondered, did we choose the wrong area within Interior Health? Maybe access in the Penticton area isn't as difficult as we initially thought, as the nearby center in Kelowna does have several PrEP prescribers. We wondered, were we too conservative in our efforts to get the word out? due to uncertainty about uptake and wanting to start small in order to assess capacity as we went. So, given that slow uptake, we decided to expand the pilot catchment area. The health outreach RN in the Kootenay boundary area, which is around Nelson, BC, felt quite confident that there would be interest in uptake. And in fact, the day after we sort of launched the pilot expansion into the Nelson area, the day after a testing event, we actually did have a client contact us to access PrEP through us. So that was encouraging. To facilitate this expansion, we talked to partner pharmacies for PrEP delivery in the Nelson area and connected with the local labs in Nelson as well. Those were fairly easy things to do. We'd already established those communication routes when we set the pilot in Penticton, and so it was very easy to have those conversations with partners in the Nelson area. And finally, we've been working on increasing our promotional efforts. We've connected further with community-based organizations to inquire about feasibility of including information on their websites to increase awareness, as well as including information on BCCDC's Smart Sex Resource website and leveraging social media such as Twitter and Facebook to spread the word. Finally, we have a few long-term goals in mind with this pilot. First, we would like to consider expansion of the pilot in other areas or even provincially to increase access to PrEP. This may mean prescribing through the BCCDC as we're currently doing, or it may actually just mean sharing our processes with other larger centers in the province so they can provide a similar virtual model to individuals in the small communities within their own radius. Second, as an organization, we would like to continue to support efforts to build capacity in local prescribers and to increase comfort with prescribing PrEP to those who are interested and who are eligible. And third, of course, we want to continue to advocate for PrEP prescribing privileges for RNs in BC, as many STI and sexual health clinics are nurse-led, especially those in the more remote areas of the province. So this wraps up our presentation. On behalf of Deanna and myself, I would like to thank you very much for listening, and we look forward to any discussion and questions that you may have on Sunday. Thanks, everyone.